The following is a preview of the classroom presentation material provided for each topic in our courses offered through LearnMedicalCodingOnline.com. Enjoy.
Okay, here's our goal. Okay, this is how the exam is laid out, the real exam. It's going to be 150 multiple choice questions. You are allowed 5 hours and 40 minutes, which is a little over 2 minutes for each question. Some will be longer, some will be shorter. You are allowed to use your manuals. It'd be pretty tough to take it without it, right? And I have in here, and notes. So these are notes that you have written in your manual. Okay, now technically, you cannot take the questions from a study guide and enter them into your book as notes. However, if you transfer the questions into information, you can certainly write down information about Medicare. You can write down information about the Federal Registry and things like that. It's information that is that applies to coding on a daily basis. Okay, so you don't want to put questions and answers in your book. Basically, what I'm saying, you're not allowed to, like, if you buy any of the study guides from AAPC, you're not allowed to enter those into your book. And you're not allowed to create pages of their study guides. Okay? But we are allowed to make notes in here that help you code.
That's a lot of wool for something you paid for. I paid that $49.95 on new study guides. I'm using them.
Well, maybe they use the same questions on their study guides as they do on the test. I don't know.
You do better.
Okay, so the CPT manual is the AMA one that we have here. As far as the ICD-10 and the HCPCS, you can use any version that's out there. They make multiples of those. Okay, it's a paper exam with an answer grid, like a lottery fill in the bubble thing. Mine was 5 columns with 30 questions. I doubt if they've changed it. It's probably the only way the computer reads it. Okay, if you take it on a Saturday, you'll know by the next Friday whether you passed. Okay, the exam format, it's 70% to pass it, meaning you can miss 45 out of 150.
I've been training for 40.
And currently, what was the price of it? $380? So it's $380 for the exam. And plus how much was your membership for student membership?
110.
Pardon me?
I want to say
110, so there you go, $500. Okay. You get 2 tries for your $500, but you won't need it because you're going to pass it the first try. However, 40 to 50% of the people that do take it fail the first time.
That's because they didn't
So,
use the mic.
No, it has nothing to do with me. It's all you. So don't let it crush you. Okay? I'll do the crying. You call me, I'll cry for you, and then you can roll on. Okay, the reward is you get a better career with bigger salary. And it only costs you $500. Okay, so the question breakdown was all of the chapters of CPT. And then there'll be about 8 to 10 questions of medical terminology and anatomy. The ICD-10 guidelines, which we're going to take a review of those again too. Okay, the entire book. And then you have HCPCS. There aren't that many, but the ones that they are going to test you on will probably be the different sizes of the drugs. Like the patient received 1,000 cc's of this. How would you code it? And then they give you choices. So when you're referencing the codes, it'll be like, well, this one's 300 or this one's 200. So you're going to have to figure out how it would code to 1,000. So that would be the most difficult question of the HCPCS code. The rest of them will be with, well, they had a hospital bed without the railing, or they had the hospital bed with the railing. So, and you've done more examples of those than I ever did.
Detail.
So, yeah. So I think.
I ordered new glasses yesterday.
So I think you guys will be ready for that okay. The time management, you guys were good. You had this as a class. You didn't have to be selfish. I made you do everything I wanted you to do. As far as preparing, same thing. The rule is you're allowed to highlight and make notes in your manual. The questions are all worth the same value. They each are worth 1 point. So the multiple pass method is what I suggest you do. Doesn't mean you have to, but it's what I suggest you do. The first time through, answer the easy ones right now. If I'm reading through it and I go, I got the answer to that right now. or it's only going to take me a minute to get to that answer, I'm going to answer it right now. If I read one and go, oh, I really don't even know where to start with this one, that's a 3. You know, and then I read one and go, I know where to find this. It's a 2. But go through and answer the ones you can right now. Do it right now. Get those points out of the way. Second time through, you can have them to your 2s or 3s or whatever you have them with. But don't spend a whole lot of time on a question that's only worth 1 point. So if you have 5 columns of 30 questions and you have 5 hours and 40 minutes to take it, keep track of the time. And I'm not saying beat yourself up with, I'm way behind or something like that. After you finish that first column, look and see if it's been an hour. If it's been 2 hours, you better hurry. Okay? If it's been about an hour, you're in great shape. Okay? So, and with skipping around, you're not going to know if you had the first column done or not. But keep track of your time. Don't let the first 4 hours go by and think to yourself, now I have to guess on 70 questions or something like that. No, it just means that how you're approaching it isn't working out. Okay, you're going to have to go faster. You're going to have to not answer this one, go on to the next one. As a matter of fact, with it being a paper exam, and you having your CPT manual, your ICD, and your HCPCS, and the categories are laid out in the test. So you'll know right off the bat you're coding out of the surgery section on page 1. Whenever it switches over to ICD and HCPCS, it's labeled on the page. So what I did was I opened my test to HCPCS and I did those. And I just tossed that book aside. I'm done with it. Okay? Turn to the ICD section, do the 8 or 10 ICD codes that are specific to ICD, and then set that book aside. And then the remainder of the exam, you'll have your CPT. You won't be going through books over and over. Okay? So if you can go at it with a plan, you know, if you have a decent plan, you'll be fine.
Okay, so there's your brief preview of our classroom material. Each chapter contains notes with voice instructions, practice examples, and quizzes. When you visit our site, you'll see links to course descriptions, syllabi for each course, and the required manual for that course. These are college-level courses offered at a fraction of the cost. If you want to learn, we teach.